This morning, Governor Reynolds held her first press conference dedicated to Iowa's COVID-19 response in months. The head of the state's public health department says they've heard complaints about the lack of data on the latest surge in cases, and they are responding. Meanwhile, the governor defended the state law that bans mask mandates. Dave Price joins us now outside the state capitol with more on what the governor had to say today. Good afternoon, Dave.
Good afternoon, Andy. The governor, a couple of times during her remarks today, talked about acknowledging that some people want her to require masks. Now, there is a state law that prevents local school board members or administrators from requiring masks. The governor signed that during this last legislative session here at the State House. She said that elected officials decided to do that. Local school board officials are also elected officials, and in this process, they no longer have that ability to require masks. The governor pointed out that she has heard that there have been instances where children have had some kind of reaction or problems by being forced to wear a mask, and she is not changing her position on that. Now, over the last couple of months, we have seen numbers going in the wrong direction here. So more people being diagnosed in the hospital with COVID-19 and more people, the sicker people, having to go into the ICU. We had asked her today that since she wasn't announcing any type of new policies or restrictions, other than saying, again, that people should get vaccinated, what was the overall point that she was trying to make today?
It's really talking about where we're at right now in context of everything. Dave, we're in a different place. We didn't have vaccines a year ago, and we were able to get our kids back in school safely and responsible. It's obvious that vaccines are our best tool against countering COVID-19. So we want to reiterate to Iowans to get the information that you need, do the research, and get a vaccine. It's the best thing that you can do to protect yourself and your loved ones. We see that the data we're collecting actually proves that out. So, just to let people know, we have plenty of tests. We want to encourage Iowans to go ahead and test if they think they have symptoms. Those are available.
Now, they are about to start releasing, through the Department of Public Health, more frequent updates about what's going on with the situation with COVID-19. A couple of ones to point out here. And this perhaps could be the bigger change, other than the fact that instead of once a week updating this, they're going to do it Monday, Wednesday, Friday, the state health department said. But they are now going to allow you to be able to figure out, for those people who are in the hospital, who's been vaccinated, who has not been. So, for example, 79% of the patients hospitalized with COVID-19, 79%, were not fully vaccinated. So that means that 21% would be those breakthrough cases. Now, this does not break down among that group there, that 21%. There's no way to know from this update about, does that person also deal with some other kind of serious health condition? That is what doctors have told us for several months now, that you're more likely, if you are fully vaccinated, despite being fully vaccinated, you could still be one of these breakthrough cases and could still get COVID-19. You're more susceptible to that if you have some other serious health conditions. Also, 90% of the people in the ICU right now are not fully vaccinated. So that will perhaps be one of the bigger changes with this, Andy, that we can now see vaccinated, not vaccinated, looking at these more serious cases.
Right, and maybe get more of an idea of the benefit of the vaccine. She did seem confident, Dave, that we are not headed toward a fall and winter like we had last year. Wouldn't you agree?
For sure, and that would be an opinion you would traditionally see across the country, even if you just take politics out of this. Obviously, doctors and nurses have concerns for a variety of reasons, but because of the availability of the vaccine, most people you talk to do not forecast it to be that bad. There's no question the numbers are going up here, and like you mentioned, with more than 500 people hospitalized with the virus, that is still, it's a lot of people, but it's still about a third as many people as it was last November when it was at the worst of this, and that was before vaccines were available. Of course, they are still not available for children under the age of 12. The governor's saying it is basically kept in line here. 2% of those in the hospital are children at this point.
Right, yeah, and that's obviously something that goes way beyond state control, but we will see, I'm sure, more information on that coming soon, and the boosters as well coming soon. Thank you, Dave. That's Dave Price reporting outside the state capitol today on the governor's press conference this morning.